Dr. Amber Schmidtke is the Associate Professor of Biology here at the University of St. Mary. She also serves as the chair of the Division of Science and Mathematics. Her specialty is microbiology, immunology, and public health. She holds her PhD in medical microbiology and immunology from Creighton University and has done a great deal of work in the scientific community, especially in this time around COVID and communication. Dr. Schmidtke, welcome. How is it that you have been called upon to use your education, your expertise during this pandemic to help educate people?
Well, when the pandemic began, I recognized that there was a big difference between the way that scientists communicate to each other and how the public can receive information. Mm-hmm. And I kind of blended my two roles as a public health professional and an educator to sort of translate what was happening for the general public. It's been a really neat opportunity to engage with not just the students that are in my classroom, but entire communities. I've been doing a lot of work with nonprofit organizations, government agencies, and working closely with the media to help them to better understand what's going on with the pandemic so that they can spread the word effectively.
Well, on behalf of all of us, Dr. Schmidtke, thank you for doing that. And we're going to call upon your expertise again here today. Our students are asking questions, and I've gathered them in hopes that you can shed some light on it that we can share with our students. So they're asking, if I've already had COVID, why do I need a vaccination?
Yeah, that's a good question. You know, it's one of those things where, we'd like to think that immunity lasts forever. But it's important to remember that the virus has changed a bit over time. And whereas most of us, if you were infected, were infected with the earlier version of the virus, we have a more transmissible form now. And so we're not totally sure how well your past infection will protect you against future infection, given the way that the virus is changing. So we do go ahead and recommend that even if you've had the infection, to go ahead and get vaccinated.
That's the message, get vaccinated. And we also heard very early on that those at high risk were definitely our elderly. When the vaccine's first out, we pushed them out to the elderly. But why is it so important for now, for young people? Are they also at risk for COVID-19 and all those implications? What would you have to say to those who are college aged, generally 19 to 21?
Yeah, so yes, the infection is a lot less severe for younger adults, but that doesn't mean that it's risk-free either. In the early days, we did have a real scarcity problem where we didn't have enough vaccines for everyone. And so the priority at that time was saving as many lives as possible. That's why many states said, we're going to give these to our elderly first. But what we see in the data is that the 18 to 29 year group population, they tend to be what starts every surge we've had. They're young, they're awesome, they love to hang out with each other and they think they're invincible, right? Mm-hmm. But what starts with the 18 to 29-year-olds fans out to older populations too. And, where we were trying to save the most lives by vaccinating the elderly, the way we stop the pandemic is by vaccinating the young, because they're the ones that are, unknowingly spreading disease the most.
All right, so then key to stopping this pandemic is helping our college-age students get vaccinated.
Absolutely. It's critically important that we vaccinate.
And that is really what we need to push on. Great. Could you talk to us a little bit? We're hearing in the news about this Delta variant. Could you tell us why that's such a game changer?
Yes. So every time that the virus infects another person, it has to replicate itself. And during that process, it can introduce changes or mutations. Most of the time, those mutations will not be helpful, but on rare occasions, they're beneficial. They help the virus to be more fit or more able to infect other people or cause disease. So what's different about this one is that it's not just more effective at transmitting to other people, it's like 6 times higher. So whereas before let me explain what I mean. So originally what happened with the original version of the virus was if you were sick, on average, you would go on to infect 2 additional people. Mm-hmm. With the Delta variant, what's happening is an infected person goes on to expose and infect 6 additional people.
Wow, that is definitely a multiplier and a game changer.
Yeah, so you can see how the numbers escalate really quickly.
And when you say it spreads more quickly or it's more contagious, could you talk a little bit more about that?
Yeah, so the reason why this is happening is because the people who are infected have very, very high viral loads. What that means is they have far more virus in their body when they cough or sneeze than we would have had a year ago with the original variant of the virus. And so when they cough, that means there's more particles that could reach you through your eyes, nose, or mouth to cause infection for you.
Thank you. That's a great explanation. Could you also speak? We're hearing about herd immunity, but that reminds me of cows. So I like to speak of community immunity. And what is it? What is community immunity? And why is that so important that we get that rate up?
Yeah, so like you pointed out, this is a term that originally started out in the veterinary field. It's used to describe sort of a closed social system of cows in a pasture. And the idea is that if we vaccinate enough animals, or people in this case, within that community, we have enough of a herd immunity sort of idea that even those who are not protected in that community sort of benefit from the collective immunity that's provided. So that's the goal. But we really have to get a lot of people vaccinated to get there, especially with COVID-19 and especially with the Delta variant. So we have some work to do.
So we were thinking earlier that community immunity might be 75% here at St. Mary. Do you think with Delta variant that's going to have to be increased?
Potentially, because when before a person could infect 2 people and now they can infect 6, it means that we have to perhaps raise our expectations a little bit more. So we may be looking at something more like 85. We're just gonna have to see what happens with the data.
Oh, great. Thank you. Tell us again about masks. I know the CDC has just come out with some more guidance yesterday. And why is it so important that people who have been vaccinated wear their mask, and when should they wear their mask? Could you give us a little guidance on that?
Sure. So yesterday, yes, the CDC came out with new guidance suggesting that even those who are fully vaccinated should consider wearing masks or should wear masks in certain indoor settings. And the reason why is because while breakthrough infection, so infection after full vaccination, is rare, for those who have symptoms, they have the same viral load as a person who was unvaccinated, or at least that's what the CDC director was telling us yesterday. So that's the reason, and I think we're going to get into this in a couple of questions, but it's one of several strategies that we have that we can use at any given time. I usually recommend that people use 2 to 3 strategies at any time. So that could be being vaccinated, having low case rates in the community, which we don't have right now, wearing a mask, social distancing, a lot of the things that we're all tired of doing, but we still need to do them.
That's a really important point you just brought up, Dr. Schmidtke. Could you talk a little bit more about multi-layered prevention that you just mentioned and how we can stack those to increase our safety?
Yeah, so I like to tend to talk about this in terms of slices of Swiss cheese. So if you're not familiar, that's pieces of cheese that have a hole in them. And it sort of helps us to paint the picture that, if you put a slice of cheese between you and I, for example, and we spit at each other, which we're not going to do, of course, but if we did, some of those particles would break through that little hole. And so the way that we protect ourselves from that sort of risk is by putting multiple pieces of cheese in between us so that those holes don't align. And so each of those pieces of cheese is a different strategy. So for example, wearing a mask, being vaccinated, having low case rates in your community, social distancing, good hand hygiene, all of those sorts of things.
Many layers of Swiss cheese.
Yes.
Keeps us safe. That's a great analogy. What are some of the long-term effects of vaccination? I know some of our students have asked about, especially our women, will it protect their fertility? What are there concerns about the vaccine that you would share, or do you think that it's safe?
I do think it's safe. The long-term effect of a COVID vaccine is you don't die of COVID, period. Because, and I don't say that glibly. What I'm saying is we have, these vaccines were designed with safety in mind, especially the RNA vaccines. So those are the Pfizer and Moderna ones. The molecule that is part of your vaccine is an mRNA molecule. This is a very short-lived piece of material. It decays in minutes. So it's sort of like a Snapchat message, in that sense that it's really something that is just there to give your cells the instructions they need to make those spike proteins that are like the ones that the COVID virus or SARS-CoV-2 will produce, so that it can learn and be ready for the next time that it's seen. Now, when it comes to fertility, there have been studies that have been done in the clinical trials. They were looking at animals, and then we've been looking at pregnant women ever since the vaccines were authorized for use. There have been no differences for those who have been vaccinated versus not when it comes to being able to get pregnant, stay pregnant, deliver a baby, and have correct developmental milestones. What I will also add is that even looking at fertility or patients that are going through fertility treatment, they've looked at both men and women and found that there's no real impact, negatively anyway, for having the COVID vaccine. We do know, though, that having COVID infection can affect fertility, especially for men, because if you have several days of prolonged high fever, that can really hurt a man's sperm count, for example.
So once again, the answer is you need to get vaccinated, and the vaccinations are very safe. I love the analogy of the Snapchat to say that this isn't something that's staying in your body. It also gets rid of the illusion that this is some chips being implanted in you. What else could you say to young people to say this is safe?
Yeah, I think a big thing is, we have two choices on how we get to immunity. And with the Delta variant, it's really kind of a question of when you're going to get sick or exposed as compared to if. Perhaps in the past, because we didn't have as transmissible of a variant, you could sort of roll the dice and take your chances that maybe I just won't get sick. But we do know that with a more transmissible variant, you are likely to get sick. And we know from the past experience that has led to hospitalizations and deaths, even among the young adults. And with the Delta variant, we're actually seeing that those who are hospitalized are younger than what we saw before. Mm-hmm. So and not just in the hospital to get some oxygen, we're talking hospital to go to the ICU.
Wow. As I even noticed on the news here in Kansas City, many of our hospitals are now full. Truman Medical Center, KU, Children's Mercy. So it's even a matter of even caring for the people that do come in sick now.
Yeah, so they're strained for sure. And so, but the problem is not only does that limit a hospital's ability to take care of those who have COVID-19, it also limits their ability to take care of people who have heart attacks, car accidents, or any other sort of medical issue that requires emergency or intensive care. Because our resources are just tapped out. There's just no room.
Oh, yes. And how stressful that must be for our doctors and nurses.
Yeah, they've been, troopers throughout this entire experience, but I cannot imagine the strain and frustration they must be feeling now, knowing that they're taking care of, they obviously want to take care of these people, but knowing that we have the tools to prevent this kind of suffering, and they're not being used or leveraged to the extent that they could be, or that, we just didn't reach these people in time.
Yeah, it's very frustrating. Another question our students are asking is, how long will immunity last if I get vaccinated?
This is still an open-ended question. We don't really have the data because it's still so new. I mean, these vaccines only got authorized for use last December. Mm-hmm. So far, it looks like they're holding up really well. And the good news about an immune response is every time you're exposed, your immune system gets more training and more reminders. And so I think that since there is so much COVID in our environment, our immune systems after vaccination are getting plenty of opportunities to practice.
Unfortunately. So how did, as a scientist, you would be familiar with this, but could you help us understand, usually vaccines take years to develop. What were the factors that went into this to help us get it to market and into arms so quickly?
It's really an artifact of really good timing, because as it turned out, the mRNA vaccines, so those are the ones produced by Pfizer and Moderna, that technology was already being developed over the last 10 years. At the NIH, for example, the National Institutes of Health, if you're not familiar. And so it was already well underway. And so really it was ready for clinical trials. They just hadn't had a chance to do so. With the DNA vaccines, that would be like the AstraZeneca or Johnson & Johnson vaccines. There's more history there. They have gone through the European Union's version of the FDA approval process for other diseases, especially Ebola, for example, which hopefully we don't ever need a vaccine for that here. But it has been through the process and been tested across all demographics.
Wow. One of the students asked, I'm fully vaccinated, so what can I do safely?
For a person who's fully vaccinated, a lot of things tend to go back to normal. At this time, because we do have high case rates, we are still recommending that layered approach. So you may be expected to wear a mask in some indoor settings, but for the most part, you can gather with other vaccinated people, have those hugs and family reunions and that sort of thing. There's a lot of things that, for me, what it has done is remove a lot of the anxiety of what happens if I get sick. I don't have to worry about that anymore.
Well, it's also such a relief to think because I am vaccinated, if I do get it, God willing, I won't die.
Yes, absolutely.
And then I'm not going to be a burden on my family or my health system, my community, if I happen to get it. So that's a big reassurance for all of us. I know here at the University of St. Mary, when we were told that we could go down and get the shots, we vacated quickly because people were just thrilled to have the opportunity to protect themselves, their families. Many of them live with parents that are elderly. And I live in a community that's elderly. So it's very important for all of us to do everything we can to protect each other, especially since here at the University of St. Mary, community is one of our core values. Let me check to see if we're getting any more questions coming in online. Is there anything else you would like to add, Dr. Schmidtke?
Yeah, I would just reiterate what you just said, what it meant to get vaccinated. I'm the sort of person that, I got one of the throwaway doses at the end of the day when it was early and my age group wasn't yet available or eligible typically. A friend happened to be working at that vaccination clinic. They saw that they were going to have 9 extra doses that day and they called me and I dropped everything and ran there and I cried in
Wow.
the 20-minute period that you're waiting after you get vaccinated because it meant that much. And when it was time for my son, who was newly eligible, we went on his 12th birthday. We went that very day while we were on vacation because it was that important to us.
Mm-hmm. Absolutely. When we got the word from the Leavenworth Public Health System that we could go down between 2 and 4 last March, I am convinced that we left this building faster than we ever had for a fire call because people were so excited and so grateful for the chance to be vaccinated. And so we hope that our students share that same excitement and that we do everything we can to keep our community safe this year by getting that vaccine. It also helps preserve our first responders. Mm-hmm. So we're all going to do our part.
Someone wants to know if people have different views from you about COVID, are they welcome to vaccinate your community?
We just got a question online that if people have different views about COVID or the vaccine, are they welcome at the University of St. Mary? Of course, everyone is always welcome at the University of St. Mary. And if somebody chooses to remain unvaccinated, we will probably continue to test them and ask them to wear a mask to keep us all safe. Just as we are a Catholic university and we welcome people of all different faiths, we all know that part of it being a university is we have different points of view and that we continue to respect each other and our points of views, and at the same time prioritizing our own health. Any last words?
Just get vaccinated.
Get vaccinated.
It is the safest and a way to get to immunity, and it is a great tool that we have. I'm so grateful that it was developed and available for us to use.
Great. So please join me in thanking Dr. Amber Schmidtke from the University of St. Mary for sharing your expertise with us today. Thank you.
You're welcome.